Hi, Kui. It's been a long time since I've done a Facebook Live. Knack now, Virginia Hedrick. Shragon Mewamechuk. Hello, my name is Virginia Hedrick. I'm a member of the Yurok tribe and the executive director of the California Consortium for Urban Indian Health. I'm just making sure that I'm live in all the places on Facebook. And just want to thank those who are watching this live or who might watch it on a replay. It's been a while since we've had a conversation about where we're at with COVID-19. But I also added to tonight's discussion some other things that are affecting our communities, such as RSV and what is known as influenza or the seasonal flu. So if you are watching now and you have questions, feel free to leave them in the chat on Facebook. I have it streaming there so I can see it. There is about a 15-second delay. So I'm gonna go ahead and get started. I do have some slides tonight. I know that we've had some questions that have been submitted through our social media channels and that have come to me directly, and I'm going to address some of those questions, but I want to be really transparent. We don't have answers for a lot of the complicated questions that we're being faced with right now, but keep asking them because new information becomes available often. And I want to be able to share that with folks as we sort of navigate what continues to be uncharted territory. First, I want to share that Sakui has a resource called the Red Line. We are supported by Department of Healthcare Services here in California to offer peer support. So for those of us that may be experiencing stress, anxiety, worry, or just simply have questions on navigating national, state, county resources, please feel free to call us on our Red Line. The numbers are listed here. You can also send in a chat. So go ahead and take a screenshot of this screen, or if you just remember Sakui Red Line, you'll be able to find our resources online. I do want to note that as we move into the winter season, to the darker months where the days get shorter and sunlight is harder to come by, that this can be a really challenging time for individuals, and for many reasons. Some of us are thinking about loved ones that we've lost. Some are looking to connect with family and not being able to find that connection. So I just, encourage folks to reach out to the Red Line, have a conversation with a real human on the other end who can help talk through some of this and identify any support services that you might be needing, and to be that for other people in the community. We may not be isolating necessarily as we were, early in this pandemic. We had small social bubbles and we were talking about things like keeping distance and, tracking all of our contacts. Some of that has gone away quite a bit, but there is still a lot of isolation coming where we're at in this pandemic. And I don't want to say we're out of it necessarily, because I'm going to share data that will actually tell a story that's a little bit different from that. So you'll see on the far left of the screen, case trends are trending slightly up, coming out of November. We are at over 98 million cases of COVID. Where there is particularly good news is deaths are not rising alongside of those cases. In fact, we're having a downward trend in deaths due to COVID-19. And a lot of that has to do with folks being vaccinated and being boosted. And we'll talk a little bit about some of those questions about, like, do the vaccine work? How well are they working? What have we learned being this far into it? So, but one thing that's very clear in the data is that they are preventing deaths. And you'll also see here hospitalizations. We're trending upward, and they're just starting to trend downward. Vaccinations are only at about to almost 13% with those who have been vaccinated with an updated booster. So we are really looking at the booster as being a critical part of being vaccinated and ensuring that you're up to date with your booster and whatever booster series you might be on. The most recent boosters that are available are called the bivalent boosters, and they account for the most recent strains of COVID-19. So they work a little better than the original boosters. So we've been asking community if they have questions on COVID-19. And some of the questions are, what are the chances of catching it now that masking is optional and a lot of folks are without masks? And this is a really tricky one. And I always bring it to you guys completely honestly. So, you know, the chances of catching COVID increase as community transmission increases. So that's why we always start these conversations with like, how many people have COVID right now? The more people that have COVID, the likely you are to get COVID or have it being spread. So it's important when we see a level off or a downtick of COVID, then certainly your chances of getting COVID are less. There are more people that are vaccinated, and that has helped reduce the spread of COVID substantially. You know, the efficacy of reducing transmission, so from getting COVID from the vaccines, really ranges from about 24% to, you know, up to upwards of 50%. The vaccine can eliminate your risk of getting COVID, but that's still a pretty big range that even if vaccinated, you'll get COVID. Masking was and has been and continues to be a really important tool in preventing the spread of all infectious disease, including COVID-19. The best mask to wear is an N95. That's going to protect you the best. Certainly a surgical mask or a cloth mask is helpful. Those are more helpful when everyone in the room is wearing a cloth mask. So that can help you make decisions about what type of mask you're going to wear and what situation you want to be wearing a mask. You know, as always, any mask is better than no mask, but there are actual differences in the type of mask you wear and the environment you're in. Really, for surgical masks or cloth masks to be really effective, we want about 50% of the people in the room to potentially be wearing a mask. Two, why are people not taking precautions anymore? And I think that's really an observation. One, you know, I'll say that I think people are taking precautions. I think that, and we know that testing has continued, there has continued to be a demand for testing. Folks are also testing at home. So it's really common for folks to be testing for COVID at home, bringing that resource into your own home and being able to make decisions on whether or not you'll have people in your home, whether you'll travel, whether or not what you're experiencing is allergies or if it's COVID. So I think that there are actually a lot of precautions that are in place. It's true, we're not seeing the same level of masking. Masking mandates have gone down. The state of California still has a strong recommendation on masking. So one, I want to say that I do think people are taking precautions. It does look different. So there's that piece. I don't expect mask mandates to be back in effect though. Certainly if the rates of COVID were to increase at a point again that would put stress on our health system, I think that the state of California and or, you know, CDC would be looking at mask mandates again. I got 2 COVID shots in 2020. Should I get a third booster this year, and is it necessary? So yeah, I think that getting a booster is necessary at this point, particularly the bivalent booster, which will offer deeper protections. The word efficacy, I've used it. That's like how effective the vaccine is. We do know that the longer you have been without a COVID-19 booster, the less effective it'll be. And this isn't new information about vaccines. If you're, you know, aware, the seasonal flu vaccine is offered annually, and typically we start encouraging folks to get the seasonal flu vaccine in September, October. We have seen an earlier flu season this year, but this is, you know, having recurring vaccines is something that is common and will give you the best protection. Does getting a booster really change the chance of me getting COVID? It seems like there's a new booster every few months. And I think that's true. It does feel like that. It does feel like there are new boosters coming out often. And, some of us are struggling to keep up with like, where am I at in my booster series? And it can feel daunting, right? Because for some of us, when we get the booster, we feel run down, we feel tired, we have some of those side effects related to the booster, and there may be some hesitancy in wanting to get a booster, but I do think it's still really important. I already kind of shared the reduction in the chance of getting COVID with being fully boosted, really ranges between like 55% and 25%. Those are really good odds. Those are really good odds. That's what we expect from a sort of seasonal flu vaccine, is about 50% odds. And you should know that American Indian Alaska Native people have been disproportionately, so we've been harder hit by COVID-19. So being able to be that fully vaccinated and be boosted to reduce your risk of severe illness to COVID is really an incredible opportunity to stay out of the hospital. And so yes, it does reduce. The answer is yes, it reduces your chance of getting COVID. And there are new boosters that come out. That's just part of staying up to date with the science and how we can best protect the public. Does the booster help protect from other illnesses such as the flu, cold, and RSV? So no, it doesn't necessarily directly protect you. The COVID-19 vaccine is not going to protect you from getting the flu, the common cold, or RSV, but it potentially will protect you from having compounded illnesses at the same time. So it can reduce your risk of getting COVID-19 in the first place. Second of all, it can reduce the type of how severe COVID-19 might be, particularly if you couple it with getting the seasonal flu at the same time. You can get a seasonal flu shot. Influenza shots are available. So it's best to get both COVID-19 booster and your flu shot. You can get them in the same day. There is not a vaccine for RSV. Well, we're going to talk about why that makes RSV dangerous, particularly for our most vulnerable. The best ways that we can prevent getting RSV is by washing our hands, staying home if we're sick, and really being on alert for what RSV looks like. How effective are the new boosters compared to the previous, and why do I need it? So effectiveness of COVID-19 vaccines, the further we get out, the more data we'll have. So right now, the newest boosters are proving to be, effective anywhere from 95 to 57% on reducing severe illness and the need for hospitalization. Okay, so let's talk RSV. Each year in the United States, so RSV is not new. And I didn't include in this presentation monkeypox, but I know for a while it felt like we were just getting hit with like lots of new things. First it was COVID, and then it was monkeypox, and now it's RSV. Both monkeypox and RSV are things that actually predate COVID. These are not new illnesses. They're not things that have not been completely studied. We know about monkeypox and we know about RSV, pre-COVID-19, but I think it's that fatigue that we're getting from infectious disease. So in the US each year, approximately 2 million people get RSV that don't require hospitalization, particularly in younger children than 5 years old. And it can be that adults are getting RSV and transmitting it, but it's not affecting us in the same way that would even take us to the doctor to be tested to see if we have RSV in the way that it affects younger children. Approximately 58,000 to 80,000 hospitalizations for RSV are among children younger than 5 years old, 60 to 120,000 hospitalization among adults 65 years and older, between 6,000 and 10,000 deaths among adults 65 years and older, and between 100 and 300 deaths in children younger than 5 years old. So we're really talking about, for some of this is similar to COVID-19, that 65 plus age range as being more vulnerable to severe illness, to RSV, and then different from COVID, we're seeing severe impacts to young children under the age of 5, and particularly babies who haven't had an opportunity to really build their immune system yet and fight off something like RSV. There's not a vaccine for RSV, and the best form of treatment, if you're not having a severe outcome, is to stay home, stay rested, stay well hydrated. If you're having severe outcomes, it is important to see your primary care physician and be treated, in the number of ways that a doctor might treat you. They might, have an inhaler, you might do oxygen treatments, and of course, leading up to potentially hospitalization. This flu season, so we're looking at COVID-19, we're looking at RSV, and then the seasonal flu. And I will say that, we haven't been talking about the seasonal flu in the last couple of years because we have had these measures in place that also reduced the seasonal flu spread. We were isolating in 2020. In 2021, we were starting to be back and families together and be out and about, but still there was limited spread, and folks were masking, mask mandates were still in place. And so now coming into 2022, where there is no more mask mandates, people are out back in the public more than ever during this pandemic. We have seen, a rise in early flu season. So laboratory flu positivity is up. Outpatient flu treatment, that means you're not requiring hospitalization. We're trending up on hospitalizations. In the state of California, we've had 36 deaths due to the seasonal flu and 12 identified outbreaks. So California statewide, we're at a high activity level for influenza, particularly in the lower southern region and upper southern region of California. We have very high rates of influenza. There is a flu vaccine available, so get vaccinated if you haven't. You can be tested for the flu too. So if you go to your primary care provider, you can be tested to see if you are testing positive for the flu. And there are sometimes antivirals that can be given if given at the right time, that can help offset some of the symptoms related to the seasonal flu. So how do we sort of navigate all of this, right? You've heard me say this already many times tonight, get vaccinated, get boosted, and get treated. So what's also available this season is available to be treated for COVID-19. We do have, COVID-19 treatments that are very effective. Paxlovid is very effective in reducing the symptoms related to COVID-19. And early data is starting to suggest that taking Paxlovid or reducing your symptoms of COVID-19 could also potentially reduce your risk of long COVID. I don't have a whole section in my presentation tonight on long COVID, but long COVID is something that's emerging as a new area of study to look at people who continue to have COVID-like symptoms or symptoms that are being drawn on way past having COVID. And I'm hesitating talking about long COVID because we don't have a treatment for long COVID, and it can be really stressful to identify and to think about having long COVID. We don't know how long COVID will last, if it will have, years and years. This is something that will go away, in 6 months to a year. We're still learning about long COVID, but long COVID can be continued respiratory issues, such as asthma, but it could also be things like brain fog, simply not being able to really remember things really clearly. It can be things like fatigue, like just feeling really tired all of the time post having COVID and post being recovered from COVID. So there's a really long list of things that are related to having long COVID. So if you're somebody who has had COVID and you're thinking, wow, it feels like I've just never gotten better, or you're feeling like there are symptoms that might be related from having COVID, it might be long COVID, and it is worth having a conversation with your primary care provider, with your doctor, about potentially ways to mitigate long COVID symptoms. As always, I hope this is like one of the big take-home lessons that we take from having COVID and, or, from experiencing something like the pandemic is stay home if you're sick and test for COVID. Help reduce the spread of infectious disease. Wear a mask. I already shared that there's no vaccine for RSV, so wearing a mask can significantly slow the spread and help protect those most vulnerable who don't have yet the immunity. The other thing that we're seeing about this piece about like don't have the immunity yet is we have what has been termed as, COVID babies. And those are babies who have been born during the pandemic where their exposure has been really limited. Maybe they stayed home and they didn't go into childcare settings. They have had limited exposure to family gatherings. And maybe in this 2022 year is the first time that these babies are getting exposed to everything and they're getting sick, it feels like all of the time. Some of that has to do with building immunity to infectious disease. So some of these are the unintended consequences of that. Always really important to wash your hands with soap and warm water for at least 20 seconds. These are just like the tried and true things that we've learned through COVID as being a really effective way to prevent spreading germs. Cover your cough or sneeze continues to be really important in reducing the spread of infectious diseases like COVID-19, the flu, and RSV. So, I've already shared where we're at with the emergency use authorization for, adults, but you should also know that the bivalent booster is available for children. It's available for those 5 to 11 with Pfizer and those 6 to 11 and 12 plus with Moderna. For Pfizer, those 12 and above just receive the adult dose. So children can absolutely be boosted with the bivalent booster. All of our 4 youngest children are boosted with the bivalent booster. And I could just share anecdotally in our household, there are 6 of us. Of the 6 of us, 2 had sort of a little bit of a side effect from getting the bivalent booster. 2 members of the household felt very sick the next day, really sore arms. Not very sick, they felt very tired. So we had kind of planned getting the booster. We got it on a Saturday so that on Sunday, if any one of us were feeling run down, we would have a day to kind of recover. So that's something too, to also just, plan your lives, that you might be someone. I personally didn't have any side effects from getting the booster, but I was aware that it could happen and would have been ready for it. Okay, I think that's what I really wanted to share. The other piece we had questions about, and I told you this before, you can get both the seasonal flu and the COVID-19 vaccine on the same day. There are a lot of questions. I was talking to a colleague just before this, questions that have come up for me and for family and community as well, which are circling around, it feels like when are there side effects of having COVID and then getting boosted? Am I likely to, what makes me more likely to experience long COVID? What makes me less likely to experience long COVID? I heard from one individual, it feels like because I had a severe case of COVID when I got my booster, it brought on COVID-like symptoms again. And, there's not clear data on any of this. And I've been kind of digging through it to see, can we really say definitively what my, some of the answers to these, like if I've had COVID twice, does it mean that I'm going to have a more severe reaction to getting the booster? And it's just not really clear yet, but I just want to speak to that I know that there are questions about side effects, the side effects of, having the flu and COVID at the same time, what a recovery path looks like. Those are all things that we're looking at SACUI as well. Knowing that long COVID is both a physical impact, what have been the spiritual impacts of this, what have been the impacts of mental health on all of us of all ages, for adults, for young people. I wish that tonight I had the answers to all of these pieces, but I don't. What I can tell you is coming into this winter season where folks might be gathering for winter solstice, you may be gathering for other holidays such as Christmas or New Year's or Hanukkah, or any of the reasons why we gather in the winter. Wintertime is a often traditional time to be gathering to share stories, to spend time together indoors. And so just want to continue to remind people to stay home if you're sick, to have people test if you're, if you have the ability to have people test before gathering. I know we were laughing at Thanksgiving because one of my uncles came over for dinner and he said, Virginia, I have this little cough going on. I'm COVID negative. I'm negative for the flu. I've spoke to my doctor about it. I'm not infectious. I just want to let you know. And everybody kind of laughed because it's like, of course he came to me to tell me this. But I think that that's okay. Like, it's totally okay to normalize reducing the spread of infectious disease, particularly when we know that these things can have deep impacts on vulnerable communities like ours. That's all I wanted to share tonight. Please feel free to, as always, send me a message if you have questions. I'll be really honest with you and tell you if I have the answer, who's looking at the answer. Is it Johns Hopkins? Is it the CDC? Is it, DHCS? There are many ways that we continue to look at COVID. We continue to be looking at wastewater. So, what's COVID looking like in sewage? We continue to track what's happening around the world with COVID-19. So we're not out of this. We're not out of the pandemic. We're definitely in an endemic. So, it's going to be here for a while, for an unforeseeable amount of time. We're going to continue to have conversations about vaccines, how effective they are, how often we should be getting them, and all of the sort of side effects and navigating all of this. So yeah, that's it. I hope you all have a great evening and we'll talk to you soon. Talk to you, Kim Newichik.